Emanuel syndrome is a chromosomal disorder that interrupts normal development. It is named after cytogeneticist Dr. Beverly Emanuel. Other than Emanuel syndrome, it is called derivative 22 syndrome, derivative 1122 syndrome, and a partial trisomy 1122. More than 100 individuals with this condition have been reported. Children that have Emanuel syndrome have weak muscle tone and do not gain weight and grow normally, which leads to intellectual disability. However, puberty is unaffected. The outcome differs from every person, but there is usually a moderate to severe level of developmental disability. Children with Emanuel syndrome often have poor motor skills. Therefore, specialized meals are often necessary, such as pureed food. In extreme cases, around 19%, a tube that is implanted into the stomach is used to feed the children. Another problem with feeding is reflux, where the stomach acid comes back up into the esophagus. Medication is often used, and surgery is rare but possible. Since they have weak bodies, children with Emanuel syndrome are prone to infections, including pneumonia, a chest infection. Low levels of antibodies that can fight infections are present in these children, and a medication called IVIG, which is a transfusion of antibodies, can be used to help this. Seizures have also been reported by 48% of parents. Physical features of Emanuel syndrome is a small head, a small lower jaw, and different distinctive facial features such as an opening in the roof of the mouth called a cleft palate or a high arched palate. Abnormalities in the ears are also common, such as holes in the skin right in front of them. The ears are often low-set and malformed. Heart defects and absent or small kidneys are additional signs of Emanuel syndrome, which can be life-threatening in childhood. There are usually speaking and hearing problems as well. Most children affected by Emanuel syndrome do not learn to talk and often have hearing problems. Children often learn a few words or simple sign language. About 14% of people with Emanuel syndrome have hearing aids or cochlear implants. Hearing loss in the children that have Emanuel syndrome is due to infections of the ears. Oftentimes, the children have tubes placed in their ears to drain fluid that accumulates and leads to infections and hearing loss. Different formations of the brain are also possible. Hydrocephalus is the most serious case. If hydrocephalus occurs, there is an abnormal increase in the amount of cerebrospinal fluid inside the ventricles of the brain. Surgery is often necessary to relieve the pressures on the brain. Also, males with Emanuel syndrome often have genital abnormalities. Emanuel syndrome is a result of extra genetic material from chromosome 11 and 22 in every cell. People with Emanuel syndrome have an extra chromosome added to the usual 46 that is a piece of chromosome 11 attached to a piece of chromosome 22. Almost every case of Emanuel syndrome is inherited from an unaffected parent, most often a mother that is a carrier of the disease. The mother is usually the one to pass on the disorder because there's a 50% chance of an egg being affected, while males that carry the disorder do not produce affected sperm at such a high percentage. People with Emanuel syndrome inherit the disorder from their fathers 5% of the time, while it is inherited 95% of the time from their mothers. The parent does not have Emanuel syndrome because they carry a chromosomal rearrangement between chromosomes 11 and 22 called a balanced translocation. A balanced translocation is a chromosome abnormality where chromosomes fuse together. However, since it is balanced in the parent, the genes are fully functional and have no effect. When the chromosome abnormality is passed on to the offspring or children of the carrier parent, the translocation becomes unbalanced, which causes the signs and symptoms of the disorder. Emanuel syndrome is diagnosed through a test called a chromosomal analysis or G-banded karyotype. In the test, a picture of the chromosomes in a single cell is revealed to show the translocation and extra chromosome. For this test, a blood sample is sent to a special lab called a cytogenetics lab. Currently, there is no specific life expectancy for people with Emanuel syndrome. There have been reports of people in their 30s living with this disorder. The severity of the syndrome is the main contributor.